Have an overview of the upper limb muscles. So starting with the first muscle, this is your pectoralis major muscle, and pectoralis major, this one is your deltoid muscle. And let's look at this one, that is your infraspinatus, this is your supraspinatus muscle. Okay, and inside this muscle there is a teres major muscle. To see the teres major, I'll remove the infraspinatus as well as supraspinatus. Now you can see the two muscle, this one is your teres minor and this one is your teres major muscle. Okay, so let's just once again see, this is teres major and this one is teres minor. This one is your latissimus dorsi muscle. Okay, so let's just remove the latissimus dorsi also, and teres major and minor also, and deltoid also we have removed. Now we have been left with some muscles. What are these muscles? Let's see. Which muscles are these? What is this muscle? This is your serratus anterior muscle. You can see the attachment of the serratus anterior muscle. And let's remove the pectoralis major muscle. This was pectoralis major, so let's remove the pectoralis major muscle. Okay, after removing the pectoralis major muscle, we find this small muscle, that is pectoralis minor. And pectoralis minor, this one is serratus anterior. Now we are left with one muscle here. What is this muscle? What was that muscle? Let's just look at the muscle that I have just removed. Okay, we were left with this muscle. So what is this muscle? This is subscapularis muscle. Okay, can you see, this one is the subscapularis muscle, and here we have the subclavius muscle. So these are the various muscles of the upper limb. Now let's just see, we have just sliced it and took an axial view. So on the axial view, let's look at various muscles from anterior to posterior one by one. This is the pectoralis major muscle. Behind this we have the pectoralis minor muscle here. Then this one is your pectoralis major only, and this you can see is the pectoralis major, pectoralis minor, and this is your humerus. Humerus ke side mein this is deltoid. Which muscle is this? This is your latissimus dorsi muscle. This is the teres major muscle. Okay, in front of this latissimus dorsi, this is teres major muscle. Then we have the subscapularis muscle here. This is your subscapularis muscle. This is your infraspinatus muscle, and here we have the teres minor muscle. Okay, this is your serratus anterior, and here we have the pectoralis minor muscle. Once again pectoralis major muscle, pectoralis minor muscle. Then here we have the latissimus dorsi. This is latissimus dorsi. Which muscle is this? This is teres major muscle. We have the deltoid here. We have the infraspinatus here. We have the teres minor muscle here. This is teres minor. This one is your subscapularis, and this one is your serratus anterior muscle. Okay, so these are the various muscles that we can see in axial view. So let's just see the deltoid muscle. What is the deltoid muscle doing? It is causing the abduction. Can you see? It is causing the abduction. So here we can see, first of all, supraspinatus, first 15 degree, then overhead abduction by the deltoid muscle. This is the action of your deltoid muscle. So actually the origin of the deltoid muscle, you saw it arises from the inferior border of the spine of the scapula, lateral border of the acromion, anterior border of the lateral 1/3 of the clavicle, and attachment is to the deltoid tuberosity of the humerus. Innervation is by the axillary nerve C5 C6, and action is main abductor of the arm after the first 15 degrees, and clavicular fibers are involved in flexion and horizontal adduction of the arm, while the spinal fibers are involved in extension and horizontal abduction. Let's just look at the external rotation of the humerus. We can see this muscle which is carrying out the external rotation of the humerus. What is this muscle? This is deltoid fibers only. These are the deltoid fibers only which are carrying the external rotation. So deltoid is also an external rotation. Let's check the internal rotation. These are the medial fibers of the deltoid causing internal rotation of the humerus. Medial fibers of the deltoid causing internal rotation.